Good evening, Miss Thompson. I'm Miss Fairman. How are you?
Hi, I'm good. How are you?
I'm good. I'm good. So a little background history. Your mom was recently found wandering on the streets. And she was taken to the hospital. You don't live with mom?
Not currently, but I am planning on moving her in with me, and I'm going to be the main caretaker. But I will also have my sister to help me look after her.
Okay, well that's very good. That's very good. Because she was taken to the hospital and she'll be ready for discharge in 2 days. But I wanted to speak to you a little bit about as far as taking care of someone with dementia. It has a lot to do with memory loss, which may be progressive. We do have medications that we give that will help to slow the process, but there's no cure. There's no cure. So little things that you can do for mom in the home, which you're already doing something good, which is moving in with her, because that keeps her in a familiar environment. And once she's in a familiar environment, it's easier for her than to take her out of that environment into a different place. So that's a plus. Another thing, as far as safety is concerned, make sure you check out the house, see less is best. In her situation, less furnitures or anything like that is best. As far as the doors, you'd want to make sure that any door to exit the building, you have a bolt at least at the top of the door. Because since she was found wandering outside, she can try to go out. She'll try to do her regular routines. And if going out was a regular thing for her, then she can wander out again.
Should I keep the doors locked throughout the day too, or only at night?
Well, if I would keep them locked. I would keep them locked unless you are going out with her, which, as I said, her routines are great. If she used to go to church, it would be nice to still take her to church. Any little community thing that that she does, it would be great to really continue with those. So little things I'm going to talk about is just to help you when you're taking care of mom. As always, we always say, with dementia patients, we don't want to it's more about dignity, and we want to maintain privacy at all times. So not because we think mom don't know certain things anymore, that we're not going to pull the shower curtain, that we're going to put her in the bath to shower, but not pull the shower curtain or not push up the door, or that, if she don't feel like, changing her clothes or something, we're going to leave her in dirty clothes or even pajama all day. Her routine, her regular routine of what she has, it's good to maintain that routine. You are there more as an overseer right now because she's in the early stages of dementia. So for you now, really, it's best to keep her involved. Ask her questions as far as clothing. Mom, what it is you feel like putting on today? What it is you feel like eating? Keep her involved in her care. That is something, you always want to maintain. Don't take those away from her. If, whenever you are approaching her, there may be days when she don't remember you. So we always say, smile. Always be smiling and call her by name. Call her by name and call your name. Even you think, oh, but it's my mom, she knows me, or there may be days when she does not. So to be on the safe side, every time you approach mom, you call your name. Mom, it's Jordan. How are you doing? Mom, it's Jordan. Whatever. Anything you're doing, try to call her by name and call yourself by name. If there's somebody else in the room, introduce them by name. Don't assume, oh, mom, no, John. No. Mom, John is here. Mom, Jody's here. Anybody, you understand? Call them by their name. That kind of helps mom. You have to be able to look for ways that she may be trying to communicate both verbally and non-verbally. She may get to a point where she don't want to say, I'm hungry, or she don't want to say, I need to use the bathroom. But then she's in pain. But she might be fidgeting, or she might have, facial expressions. You got to be tuned into things that are unlike mom right now, so that it could be a behavior that is triggering something else.
Okay, so she'll be trying to tell me something.
Right, she might be trying to tell you something. Yes, so that, that is good to always be mindful of that. Try to keep regular routines for her as far as her doctor's appointments, but still keep her involved. Don't just make always try to keep her involved, because even though you are moving in, so you're moving in her home, so still let it feel like her home. Maybe certain things you're going to do in the home, ask her permission to do it. You know you don't have to, but it's good to ask her. If it's her home and you come in, ask her permission to do it. That's always good. It lets her still feel like she's in charge. There you go. And we don't always want them to lose that. Don't ever shout or scream. Try not to shout or scream or get angry. I know there might be times when you may get frustrated, and in this part of it, your sisters can help, because sometimes when you're taking care of a family member, it can get overwhelming at times, and you may need to just take a walk, so you may need your sister to fill in that time. Sometimes you need a little time away. As much as we love them, sometimes we need a little time away. So make sure not to get too overwhelmed. There are daycare centers, which I'm going to give you information for when I'm done. There are daycare centers that she can, you can find out about, where mom can go during the day, be around other people, play games, stuff like that. If it's a case where at some point where you wanted to go back to work, later on, if you wanted to look into home care services, they also have home care services that are available that can come in, even for a few hours. Because I know you said your guys are going to be the ones be the main caretakers of mom. But at least if you have somebody come in of 4 hours or 2 hours a day or something, it gives you a little time to go do something, and then it takes a little of this stress and burden off you. Let's see, what else can I tell you? Sometimes when mom, like there might be behaviors that are not positive. One of the ways you can actually work with getting back mom in a positive behavior is like, talk about like something about the family, like use photo albums. Photo albums are good to use. Photo albums are good to use as far as, redirecting certain behaviors. Those are good to use. So we said pay attention to cues. So as far as it is, as much as you can keep mom in a normal routine is best. But as I said, you have to be flexible to changes, because mom may be good today, but tomorrow she's not good. So just try to, be patient with her, work with her. Sometimes you may have to talk in shorter sentences, so so that she can, and give her time to process it, because it may take a little longer for her to process. So don't rush her as far as when you ask a question. Give her a little time to understand.
Okay.
Do you have any questions?
So as far as keeping the same, like her normal routine, if we don't keep up her same routine and we don't, if we do happen to make any changes, does that make it worse?
It doesn't make it worse. It just helps to keep a regular routine for her. It'll probably just make her a little bit more confused.
Okay.
Yes.
Right.
We don't want that, because she's used to doing certain things. We don't want to go in and just make changes, although we would want to.
Okay.
It's not the right thing to do for her right now. Just like if she's a person that normally gets up and she takes her shower in the morning and she gets dressed, we don't want to keep her in her pajama all day. This is not what she's used to. So as much as possible that we can keep her in her routine and doing, then she won't even feel like she's sick. She'll just be like, oh, my daughter is staying with me and we're having a great time.
Yeah.
Okay? you know. So yeah, it's not, you know, it's just a different level in her life that she is right now, and it's good to know that she has the support of her family, which is great, because a lot of times, you know, we have residents who are going, but there's nobody that is able to give that amount of time and care for them. So it's good when she has family to back her up. So I'm happy about that. So any other questions?
I think that's all for now.
Okay, so I prepared, this is a booklet for you that you can refer to as
Okay.
far as, you know, talking a little bit more about what we spoke about today.
Okay.
There's also a website there that can tell you, you know, give you more information of anything you want. But please,
Okay.
my number is at the bottom. Please free to call me if you have any more questions or any referrals. We'll make sure we get you a list of referrals as far as those daycare centers and any support groups that
Okay.
you and your family can get involved with to help with taking care of your mom. Okay?
Thank you very much.
Okay, you're welcome. It was nice meeting you.
It was nice meeting you too.
Okay, thank you very much.